Good evening, Mr. Mustafa, right?
Yes.
Okay, I'm Darren Niki Anangala. I'm a nursing student from UNIMAS. So my metric number is at 2510 if you want to know. So today I'm going to teach you one health education technique, which is deep breathing and coughing exercise for you to apply it at your home since you are discharging for today. But before that, may I know your full name?
My name is Mustafa bin Karim.
May I know your IC number?
700531130361.
Okay, may I see your wristband? Okay, so today you're going to discharge and you need to apply this technique so that you can able to breathe more. Since your prognosis is about heart failure, you need to take care your heart more. So since you discharging, who will take care you at home?
My children.
Anybody else?
I think my wife.
Okay, so this education is about deep breathing and coughing exercise. So you need some supervision from your wife and your children, since there might be some complications happens to you. So with your consent, may I start educate you?
Yes.
Okay. So first, there are several important steps you need to know about this technique, which is it is to promote lung expansion. So it helps to give you more air to your lung and helps in breathing. And then it reduces to get any heart diseases complication since you have heart failure. So we don't want to have it a further complication. It is an early stage. So have you undergone any surgery before?
No.
No surgery about heart. Okay.
No.
So it is also to reduce pain after surgery and encourage to secrete any secretions like phlegm or smoke, and also it to clear your airway for pregnancy. Do you understand about any question about this importance?
So far I have no question.
Okay. Let's proceed. So there are several things you need to prepare. I already prepared you some things such as tissues, a glass of water, plastics. This plastics is only used in our clinical settings. So you can use either your plastic bag, ordinary plastic bag, and one small pillow, or if you don't have any small pillow, you just use regular pillow that you use when you sleep. Okay, any question about this?
No.
Okay, so this is the best position for exercising deep breathing exercise. So I recommend you to sitting down just like this. Okay. Okay, let us proceed with deep breathing exercise. Before we doing the demonstrations, I just going to just tell you more detail about how deep breathing exercise is. Okay. So first, you need to put yourself at comfortable position, just like this, and then take a small pillow to put it on your hip and or the surgery place that you undergo surgery. Any question about this?
No. Should I do it right now?
Not yet.
Okay.
Let's just later we recap. Okay.
Okay.
And then breathe in slowly using your nostrils, and then hold for 3 to 5 seconds. Then slowly release using your pulse rate. You know how pulse rate is?
Like this?
Yes, but it's not necessary to feel more. Just like that. Just hold, okay? And then repeat the process 5 to 10 breaths every 4 hours. Since you are new to this breath exercise, so I just recommend you to do it twice a day. Is it okay? Okay. So let me demonstrate to you how it is. So I'm so sorry. Can I use the okay? And put yourself 90 degrees like this. Just sit down, put your pillow on your hip just like this, and then breathe in slowly using your nostrils like this. Hold it for 3 to 5 seconds. 1, 2, 3, 4, 5. And then repeat it 5 to 10 times. But since you are doing it just 5 to 10 times and twice a day. Okay? Do you have any question about that?
No.
Not? Can you demonstrate back to me?
First, sit comfortably, semi-folded, and then put a small pillow, and then breathe in using nostril.
Okay.
And then hold it about 3 to 5 seconds, and then exhale through using pursed lip. And then repeat the process about 5 to 10 breaths every 4 hours.
Okay. Since you are new, just do it twice a day.
Twice a day, okay.
Okay, there is some precaution that you need to take care. So if you feel any shortness of breath, stop it immediately. Don't push and don't force the breathing. And then if you feel any dizziness doing exercise, slow down the breath, like dizziness. Oh, I'm so tired, like this. So just slow down your exercise. And then this exercise, please start it slowly and build up the duration of the exercise. Since I recommend you to do twice a day, it doesn't make it for long. You need to build up more. Like for today, you're going to do it twice a day. But for tomorrow, if you are able to do it thrice a day, okay, just do it thrice a day. And then you can follow up with me if anything happens. And then, so for this exercise also, I recommend you to wear loose clothes, because if you use tight clothes, you may feel uncomfortable. Okay? And then choose comfortable and quite quiet environment. Since this comfortable and quiet environment, because if your home is too loud, you feel more stress, and then we don't want any complications such as heart attack or maybe your sudden collapse. Okay? Okay. And then do not force deep breathing if any chest pain. If you feel any chest pain, do follow up with our doctor and consult with the nurses or the healthcare provider here. Okay? Okay. So let us, before that, do you have any question about this?
No.
Not yet? Okay. If you have any question, just ask me. Okay? Okay. For next is our coughing exercise. It is the same as deep breathing exercise, but it just adds a little more steps. So this coughing exercise, can you tell me what is the importance I already mentioned just now?
Importance of
Coughing exercise.
coughing exercise to promote lung expansion.
Okay. Okay, it's okay. So the main thing for coughing exercise is you need to clear out any secretion such as phlegm or smoke, because we don't want any disruption. If you blockage of your airway, the oxygen cannot enter your lung.
Okay.
So we don't want any complication happens to you. And then we also want to prevent any further infection such as CAP, which is community acquired pneumonia. This is the type of infection where you get if you take your phlegm entered your airway. Okay.
Okay.
So for the coughing exercise, this is the step. First, put yourself in a comfortable position, use a pillow, and then breathe in slowly using nostrils, just like that. But you need to hold your breath for about just 2 seconds max. Okay, and then slowly release your first lip. Repeat this process about 2 to 3 times. Okay, then before we cough, we take another breath just like this, and then force a breath like that. Okay, and then use a plastics, ordinary plastic. Don't use this plastics to put this inside here if any secretions come out. Okay, and then take a sheet of paper and put it to wipe your any excess of secretion. Put it inside the plastic bag and throw into rubbish bin. And then repeat the process 3 to 4 times. If the secretion are already clear up, just do it until it clear up. Okay, and then rinse your mouth using a cup of water like that. Gargle it and then throw it into the plastic bag. Now I'm going to do demonstration to you. Okay. So sorry, I'm taking. Prepare one tissue. Okay, I'm sorry, I'm going. Put yourself at comfortable position, 90 degree, and then take a pillow, just like this. Breathe in slowly using nostril. Here. Hold about 2 seconds. 1, 2. Repeat it, and then slowly release it. Your breath using first lip. Repeat it about 2 to 3 times. Okay. And then take another breath. Force it. Okay, throw it inside. Okay. And then throw it into the rubbish bin when you are done. So gargle it with your water. Just like. Okay, can you do the written demonstration? And before that, do you have any question about this?
No.
No. You fully understand the
Yes.
steps? Okay.
I tried.
So without the module, can you repeat?
Okay, first sit at the comfortable position,
Okay.
and then put a small pillow, and then breathe in using nostril deeply, and then hold about maximum 2 seconds, and then exhale using first lip,
Okay, correct.
and then repeat it 2 to 3 times. And then lastly,
Okay.
then throw it into the
Okay,
plastic.
correct steps. And then, since you're able to do it by yourself, there are some precaution you need to take care. So just like the deep breathing exercises, they're also precaution, but it's a little bit different. So if you feel any pain, stop the exercise and do consult with our healthcare provider here immediately, since we don't want you to feel any burden when doing the coughing exercise. And then if you any signs of blood and secretion, immediately go to the hospital to check out. So since you already put out all the secretion, you need to assess the things that come out. If the secretions come out greenish or colorless, just put it inside the bag and throw away. If any like blood or something that apart from normal things, you need to go to the hospital. Just consult with our doctor. So bring the evidence to them for them to check any abnormalities about your situation. Okay, and then do not do the exercise after eating. This is because let me give you an example. So if you eat a porridge or anything 2 hours before you do this, and when you're coughing, there will be we just afraid that your food will not tolerated by your digestive system. So at least about 2 hours after you eating, you're going to start the exercise. Okay, don't do the exercise just after the eating. Okay, so and if you have any chest pain or shortness of breath when do the coughing exercise, stop immediately, and then feel fatigue. If you feel any fatigue or weakness, stop first, and then continue when you regain your consciousness. Okay. So that's all for me. Do you have any question? But before that, I will ask you some questions. So for deep breathing exercise, if anything happens to you, what will you do?
So for deep breathing exercise,
Okay.
Stop immediately.
Okay.
If I have any shortness of breath
Okay.
or any chest pain,
Chest pain.
yes, and then deep breathing. Okay. And then immediately go seek.
Oh, okay. Immediately seek a professional
Yeah.
to check yours.
Yes.
Okay. For the coughing exercise, what is the precaution you need to take?
If there's a secretion that is out of normal characteristic of this secretion or sputum, then keep it and bring it to the hospital.
Okay, correct. I think that's all for me.
I have a question about the abnormal secretion that I have. How to bring it to the hospital? Do I put it in any container or?
Since you put it on the tissue,
Okay.
just put it inside not plastic bag. I'm not confident about plastic bag.
Okay.
Just use a small container,
Okay.
a round container. Just put it there with your tissue. If you're not using your tissue, just put the liquid inside and bring it to the hospital. They will check further about it. Okay.
Okay.
Any other question we need to ask?
I think that's all.
Okay. Please take care of your health and do it at least twice a day, because this is very important for you to maintain your respiratory system. Okay. Thank you. That's all from me.
Thank you.